So as you guys can see, there is some pretty substantial or potential out-of-pocket expenses with Medicare. Part A's got deductibles, it's got co-payments or co-insurance. Same with Part B. We've got a Part B deductible. We've got 20% co-insurance out of pocket. So what do we do to protect ourselves against these out-of-pocket costs? This is a situation or a decision where Medicare can get very confusing, right? What are we going to do? This is a very, very important decision. It can be a difficult decision, but you really got to understand what options are out there to make sure you make the right decision for yourself, okay? You really have two different types of plans to choose from, okay? Two different roads to look down. If you're turning 65, right now you're probably getting phone calls and mail. People might be coming to your door. You're getting plan information from every major insurance carrier that exists. And it can be overwhelming, it can be confusing. Even if you're on Medicare, you've been on it for 10 years, there's certain times of year where you're going to be so popular and get so much information, it's really hard to decipher what is what, right? What are they telling you and how does this work? So anytime we're advising somebody on what plan options might be best for them, we really try to pull this back and we try to simplify it a little bit, okay? You know, we feel like the decision that somebody is making is, do you want to keep original Medicare as your primary insurance, or do you want to give it up? You might be saying, well, what do you mean? Keep it as my primary, give it up? How does that happen and what does that mean? Okay, so again, original Medicare is a primary insurance, okay? We discussed Medicare Part C, which is Medicare Advantage. These are Medicare replacement plans, okay? These plans actually replace your Medicare. Yes, you are still a Medicare beneficiary, but you are no longer using Medicare as your primary insurance, okay? You've now been enrolled into a for-profit private insurance plan. This is very, very important to understand, okay? Well, why would somebody keep original Medicare as their primary insurance? Why would they do that and have those potential out-of-pocket costs? Well, under original Medicare, you will retain great control of your health care. A lot of people decide to keep original Medicare for a couple of reasons. Number one, original Medicare is fully portable anywhere in the United States. You're not limited geographically. If you have multiple homes, if you travel, if you ever want to seek care outside of the state that you live in, with original Medicare, you will have the ability to do that. You're not going to be geographically restricted. With original Medicare, you're not going to have to worry about approvals and referrals, networks, right? You can see any doctor that accepts original Medicare anywhere in the United States. You don't declare a primary care physician, okay? Currently 97% of all medical providers accept original Medicare, including all hospitals and all cancer centers. Another great thing about keeping original Medicare is that Medicare itself, right? The federal government is not for profit, right? So they're not trying to make money off of you, right? So it's managed a little bit differently, right? Meaning your doctors are in total control of your health care. They can treat you the way that they want to treat you, okay? So when discussing the two different plan roads with somebody, it's important to understand a lot of the protections that you get with original Medicare. All right, you stay in total control of your health care, and your doctors can treat you the way that they want to treat you. Okay, that's the benefits of original Medicare. The other side of that is the Medicare Advantage, which is the Medicare replacement. And listen, there's lots of people on Medicare. There's lots of different situations. Here at the Health Exchange Agency, we do original Medicare with supplemental plans, which we'll discuss in a little bit. We also do Medicare Advantage for our clients as well, right? There's not always one solution, just for everybody. So we have access to all the different plans, all the different carriers, but it's very important that somebody understands how these plans are different, right? The education of this process is very important when someone's deciding, okay? So your Medicare Advantage, which is also Part C under Medicare, right? Before we get into the coverages, it's important to understand these plans will replace your Medicare, and you will be enrolled into a for-profit private insurance, okay? So these plans are getting a monthly subsidy from the federal government to take over your health care. These are managed care plans. If you see Medicare Advantage, I want you to think Medicare replacement. And again, not saying that this isn't a good option for somebody, but you just have to understand how these two plans work very differently, okay? So if you opt for a Medicare Advantage plan, a private insurance company will become your primary insurance. It's not going to be original Medicare. You won't show your red, white, and blue Medicare card when you go in for medical services. You would have the card of a private insurance carrier. Maybe it's United Healthcare, maybe it's Aetna, maybe it's Cigna, maybe it's Humana, right? So a private insurance carrier will be your primary insurance, okay? And it will be a managed care plan, meaning you are going to have networks, you might need referrals, geographically you might be restricted on when and where you can get your health care, okay? Again, might be a good option for somebody, but it is quite different than the way original Medicare works. Again, with original Medicare, you are in total control of your health care, right? With a Medicare Advantage plan, private insurance is going to have a much heavier hand on where we can go and the type of care that we can get. Okay, so let's continue the conversation a little bit more in detail about if someone decided to keep original Medicare as their primary insurance, what other steps are they going to have to complete? If somebody decided that a Medicare Advantage plan was best for them, what exactly would that look like? What are the coverages? What does it include? Okay, so if you decide that keeping original Medicare is best for you, in order to pick up the out-of-pocket expenses under Part A and Part B that we just reviewed, you're going to need to add a Medicare supplement or a Medigap plan, okay? There's currently 10 standardized supplemental plans that are available. These plans are all designed by Medicare, okay? Medicare supplements are a standardized plan, okay? So what I mean by that is, and we'll get into more detail, but as I mentioned earlier, Medicare loves their letters. We're going to get a few more letters here. Okay, so a Medicare supplement is identified by the letter that Medicare assigned to it. So for example, we have a Plan G as in George. With a Plan G, any Plan G that you would get from any carrier is a standardized product. Again, Medicare designs them. Insurance companies decide if they want to offer them. Okay, so first of all, Medicare supplements are a standardized product, something to keep in mind. Second thing is, a Medicare supplement is real insurance, right? It's a binded policy. It's issued in your name. It's guaranteed renewable for life. It can never be taken away from you, okay? It's real insurance. Part of the education is understanding that a supplemental plan is not always guaranteed to be available. For example, if we turn 65 and at that time we decided, hey, a Medicare Advantage plan is best for me. At 68, our health changed, right? Now our access, our need to medical care increased, and we said, hey, you know what? I think I would like to get one of those supplemental plans. I want to get back on original Medicare. You know, you need to understand that that is not a guarantee. Really, the only time you have guaranteed access to a supplemental plan as you're turning 65, and again, we went over your IEP to enroll into Medicare A and B, you are also going to have a personal open enrollment window where you can get a supplemental plan, no health questions, no underwriting. You are in total control. You can get whatever you want when you are in your open enrollment window. That's when you're taking your Part B for the first time. You only get one shot at this, okay? So you do need to understand how important that is and how maybe that plays into the decision that you make, okay? So again, supplemental plans are standardized by the federal government. They are real insurance, okay? This is a binded policy like life insurance. We are not guaranteed to get one, okay? Certain states have some protections, but again, during your open enrollment window, your personal open enrollment, which starts 6 months, okay? Your initial election period to get into Medicare is 90 days before you turn 65. Your personal open enrollment window actually starts 6 months. So for those folks that are getting ready to turn 65, now you know why you're very popular. And that's why you're getting the phone calls and the mail. And everyone's trying to get your attention, because 6 months out from turning 65 is when you're actually able to make a plan selection, get a supplemental plan. Again, nothing can be held against you, no pre-existing, you are in total control, okay? Now, with the supplemental plans, again, there's 10 standardized plans. Right now, the two most relative or prominent supplements are the Plan G and the Plan N, okay? So with a Plan G, these plans would have a monthly premium. So a supplemental plan has a monthly premium, okay? The coverage under the Plan G is this. You would have to satisfy the annual calendar year deductible of $240. That's that Part B deductible we went over earlier. You would pay the first $240 out of your pocket. Once you have satisfied that, you will then be covered 100%. So the Part A deductible we went over is $1,632. Any co-insurance in the hospital, any co-payment at the skilled nursing facility, 20% outpatient, your Plan G would cover all of that. Very easy to understand. You're going to pay the first $240 out of your pocket, okay? Once you satisfy that, medically, you're then covered 100%. Very easy to understand. The second plan that I would always discuss with somebody or have them consider is a Plan N as in Nancy. Okay, so the Plan N, you would have the same $240 deductible out of your pocket, just like the Plan G. You would then also have two other potential out-of-pocket expenses. Okay, one is a $50 copay at the emergency room, okay, which is waived if you are admitted. The other is a $20 copay for office consultations. Okay, so under that Plan N, $240 deductible, just like the Plan G, $20 copay for an office consultation, $50 copay at the emergency room. Other than that, you're covered 100%. So just like the Plan G, the Plan N is very comprehensive. 100% in the hospital, 100% in a skilled nursing or rehab center. God forbid we need outpatient surgery, we had cancer diagnosis, we needed chemotherapy or radiation. It would cover all those services at 100%. So the great news is either a Plan G or a Plan N will give you great insurance. And again, these plans are designed to work with Medicare, meaning Medicare stays your primary. So all those great benefits of original Medicare, fully portable, don't need referrals, we don't declare a primary care physician, our doctor can treat us the way that they want to treat us. A supplemental plan does not change or interfere with that whatsoever. Again, these plans are designed to work with original Medicare. At this point you might be asking, well, why wouldn't everybody take a supplement? Why wouldn't everyone keep original Medicare and get a supplemental plan? It sounds like to me that's a great option, which it is. So supplemental plans have a cost, right? So you have to pay for your supplemental plan. These premiums can range anywhere from $80 per month, maybe up to $250 per month. It's going to depend really upon where you're located, your zip code, whether you're male or female. So please reach out to us. We'd be glad to go over the cost of them with you. Again, it just depends on where you're located. A lot of it could depend upon the age at which you buy a supplemental plan, okay? But if you do decide to keep original Medicare as your primary, you will want to consider adding that supplemental plan to pick up those out-of-pocket costs, okay? Now, if we keep original Medicare as our primary, really three things we need to do. Okay, we've got original Medicare A and B. We've gone over that. We've gone over some of our supplemental plan options. Then Part D of Medicare, going back to that Medicare alphabet we discussed earlier, under Part D of Medicare, that is your prescription drug coverage. Okay, so if we decide to keep original Medicare as our primary insurance, you are also going to add a standalone prescription drug plan, which under Medicare is Part D. Okay, it can vary a little bit by region, depending upon where you're located, the county that you're in. Usually there's anywhere from 15 to 25 standalone prescription drug plans where you are located. You might be thinking, oy vey, that's a lot. How do I figure this out? So when deciding on a prescription drug plan, the best thing to do is to get your current list of medications, whether that's 1, 5, or 10. Get your current needs, take that list of medications, independently run it through all the available plans in your area, and find out which plan gives you the lowest annual out-of-pocket cost. That's something here at HEA that we do for all of our clients. We do reviews. Upon initial enrollments, we spend a lot of time on the drug plans, okay? For example, maybe you get a supplemental plan with United Healthcare or Mutual of Omaha. That does not mean that their prescription drug plan is also going to be best for you. I would strongly advise anybody to look at your supplemental plan options and your prescription drug plan options separately. You could have a supplemental plan with Mutual of Omaha, and you could have a prescription drug plan with another carrier, okay? And again, with prescription drug plans, it's going to be unique to that individual. Doesn't matter what your neighbor has, doesn't matter what your spouse has. We need to take your list of medications, run them through all the available drug plans, and see which one gives you the lowest out-of-pocket cost. While we're doing this, I'm going to ask you, do you prefer CVS? Do you like Walgreens? What pharmacy do you currently work with, right? We want to make sure you get into a preferred pharmacy, okay? Now, prescription drug plans also have a cost to them. That cost could be anywhere very low from, believe it or not, there's prescription drug plans that are $0 per month up to $100 per month, okay? Again, you've got to get your list of medications. We've got to take a look at it and see which plan is most appropriate for you. That's your prescription drugs. So again, if you decide to keep original Medicare as your primary insurance, you have a 3-step process. You've got to get enrolled into Medicare A and B. You want to choose your supplemental plan, and you want to get a standalone prescription drug plan. That'll get you set up, all ready to go when you become eligible for Medicare. Now, our other plan option we talked about earlier was Medicare Advantage, or Part C of Medicare. We've already discussed that these are Medicare replacement plans, okay? But why would somebody opt to take one of these plans? What's going on here? So a Medicare Advantage plan is able to offer you benefits that original Medicare does not, right? What I mean by that is if you're getting advertisements, you see commercials, a Medicare Advantage plan might also include extra benefits. Dental, vision, hearing, maybe some transportation, maybe a gym membership, right? So there's some things there that original Medicare does not provide. Another thing is a Medicare Advantage plan might be a 0 premium plan. There's a lot of areas now, most plans do not have a monthly cost, okay? So with a Medicare supplement, we are paying a monthly premium, right? And we're really fixing our healthcare costs. If we took a Plan G supplement, monthly premium was $100 per month. We know no matter what happens to me this year, I have a $240 deductible. After that, I'm covered 100%. Medicare Advantage plan kind of works the opposite, okay? Typically with the Medicare Advantage plan, you do not have a monthly premium, but we're gonna kind of pay as we go, right? In the form of co-pays. So maybe if you go to your primary care physician, maybe it's a $10 copay. You go see a specialist, maybe it's a $40 copay. For things like hospital stays, outpatient surgeries, those out-of-pocket costs are going to increase. So for 2024, the max out-of-pocket on a Medicare Advantage plan is $8,850. Okay, so you kind of see we have a zero premium plan with a high out-of-pocket that includes some additional benefits that Medicare does not. Okay, those are your Medicare Advantage plans. That is Part C under Medicare. Again, this is private for-profit insurance. So what do I mean by that? That means they're getting money, subsidies each month from the federal government to manage your health care. Let's say they're getting $1,200 per month. Okay? They're going to want your medical expenses, your medical care to come in under that number, right? They're looking for profit. Original Medicare, A and B, is not for profit. They're not looking at me and saying, holy smokes, Brian, you're going to the doctor. Geez Louise, you got to have surgery. We could potentially lose some money here, right? They're not managing to a profit. It's a big difference between keeping original Medicare and giving it up. Again, not trying to necessarily push somebody one way or another, but in an effort to educate and to understand what you have, you need to know the differences, right? Again, kind of going backwards to supplemental plans is real insurance, right? It's a binded policy. We get calls in the office all the time, right? Maybe Mrs. Jones is 77, just got diagnosed with cancer, and guess what? She wants a Medicare supplement, right? Now she says, hey, I want to choose my doctors. I want to get the care where I want to get it, and I want to be able to be treated without a private insurance company being in between me and my doctor, right? Unfortunately, in that situation, you're not going to be able to get a Medicare supplement, right? If we had a crystal ball, this would be really easy, right? If we had a crystal ball, we would know exactly what to do and we would know when to do it. But unfortunately, we don't have that, right? So again, original Medicare, Medicare Advantage. Another reason why somebody might choose a Medicare Advantage plan, under original Medicare, I mentioned prescription drug plan is a standalone plan that is another potential monthly expense that you bring on. Under a Medicare Advantage plan, their prescription drug coverage is included. Okay, so you don't have to go and get a separate plan. A Part C Medicare Advantage plan will also include your prescription drug. So it'll be your medical and your prescription drug, and it can include extra benefits, dental, vision, transportation, maybe a gym membership, right? These can be very important to somebody, especially depending upon their financial situation, right? Again, all else being equal, listen, if I had a crystal ball and I knew a serious injury or illness was coming in my future, original Medicare in a supplement is probably where I should be nudged, right? Unfortunately, we know it doesn't work that way. We don't have a crystal ball. Money matters in my house. Finances can sometimes dictate where we land. And again, original Medicare, Medicare Advantage, it can all work for somebody. You just have to understand exactly what it is, and that way you can help navigate it and make sure that it works the best for you.